Hi, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of Medcovet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At Medcovet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With Medcovet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
You know, maybe you don't even think necessarily about canine rehabbers participating in hospice or participating in palliative care, but it's something we do all the time.
Welcome to Petability. I'm your host, Kathy Simon, certified veterinary technician and certified canine rehabilitation practitioner.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Good day, good day, good day, Kathy. How's it going?
Hey, Chris. I'm doing all right over here. What do you got on your schedule for today?
Well, I'm not sure that you know. We have a very special episode today as I am interviewing my friend, colleague, and podcasting partner, Kathy Simons. So this idea spawned from Kathy's recent endeavors to get certified in hospice and palliative care through the International Association for Animal Hospice and Palliative Care. I'm sure that we are all aware that our pets are living longer and surviving medical conditions and traumas that were unthinkable just a couple of decades ago. Combine this with our changing attitudes about our pets as family members who share not only our homes, but also our beds. And the discipline of hospice and palliative care is not just a good idea, but critical in providing for a good experience for our pets at the end of their lives and their families. This is the concept of a good death. We interviewed Dr. Becky Schoenberg on this topic in March of 2022 and got her perspective as a veterinarian. This episode is simply titled Pet Hospice, so be sure to check that one out. But today, we are discussing the role that physical rehabilitation plays in this realm of hospice and palliative care for our pets. So let me tell you a little bit more about Kathy. She is an experienced veterinary technician of over 35 years, having started her career at the esteemed specialty and teaching hospital Angel Animal Medical Center in Boston, Massachusetts. After transitioning to a smaller private practice, Kathy was instrumental in the creation of one of the first physical rehabilitation facilities for small animals in the United States, the Sterling Impression Animal Rehabilitation Center of New England. She gained her certification as a canine rehabilitation practitioner in 2003 from the University of Tennessee as part of the first class of 36 individuals to graduate from the very first didactic program in the world for canine rehabilitation. While Kathy continues to practice small animal rehabilitation privately, she more recently added book writing to her resume. These books include Blind Devotion, Enhancing the Lives of Blind and Visually Impaired Dogs, and a children's book called Watching Out for Digger. In a you heard it first here moment, Kathy is feverishly working on her third book, Senior Dogs, Maintaining Mobility and Independence, which will focus on geriatric care and rehabilitation of our elder pets. And now Kathy shares my vision of getting quality information to as many pet owners, veterinarians, and veterinary paraprofessionals as possible through this platform, Petability Podcast. I am proud to share that we have published awesome content every 2 weeks since March of 2020. Welcome to the show, pioneering veterinary technician and small animal physical rehabilitationist, published author of the best-selling book on Amazon about blind dogs, podcaster extraordinaire, and my friend and mentor, Kathy Simons.
Whoop, 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 whoop. Thank you, Chris. That was lovely. Yes,
I want our audience
lovely,
to know
lovely,
that, yes,
lovely.
I did not share this with Kathy ahead of time.
Yeah.
And nor did she, twist my arm, pay me, coerce me to say all those nice things about her in any way, shape,
Thank
or form.
you.
It's
Thank you.
all true.
And you know how passionate I have been about hospice and palliative care. And so I love that we're going to be able to discuss that today. And, maybe you don't even think necessarily about canine rehabbers participating in hospice or participating in palliative care, but it's something we do all the time. You may not think of it because we think about restoring function, restoring mobility, but maybe we don't think about what happens when cases like that are palliative, but then they turn to hospice and what the role of the canine rehabilitation practitioner can play in the end of life stages of a pet. Mm-hmm.
And there's beauty in maintaining quality of life when you're ill or getting older. And so the ability to be able to provide these services at the wish of the pet owners is just phenomenal, in my opinion.
Right. And I think there can be beauty in a good, compassionate, assisted death as well. I used to say to myself, how does anybody work in hospice care? This is just, it's so depressing. It's so this, it's so that. But now that I'm in it, I go, how could you not be participating in hospice care? These owners need assistance. They need guidance. They need emotional support. And these animals deserve a good, dignified death, a graceful exit, if you will.
I agree. And, we've said over the course of several of our past shows over the past 4+ years that you always say that the more disabled, sicker, impaired that they are, the more you fall in love with them as a patient. And
it's true.
Yeah, that it's your jam. And, now to be taking this coursework and, validating your passion and learning even more, skills and such in terms of this population of pets. I'm very proud of you. You're always seeking to gain more knowledge, and you are always concerned about the emotional lives of pets and the psychosocial aspects. So we're going to be delving into the show and talking not only about the physical part of being a rehabilitator, but also the psychosocial and emotional components of being a physical rehabilitationist and working with these pets. Let's start with, what is the difference between hospice and palliative care? Because that's always been very confusing to me.
Good question, Chris. Good question. The primary goal of palliative care is to provide relief from symptoms and stress of the illness, regardless of the pet's prognosis. So palliative care can be offered at any stage of an illness or a disease, not just at the end of a pet's life. And this is something we do all the time in rehabilitation. And it may be as simple as recommending modifications within the home to accommodate the pet's needs, or pain relief with therapeutic modalities, or maybe even improving function with an assistive device. So we focus on improving the quality of life for our patients and their families. And palliative care can be offered alongside of curative or life-prolonging treatments. So the difference here is that hospice care is primarily about providing comfort, pain management, and emotional support in the final stages of a pet's life. So the goal is to help the patient experience a dignified and comfortable death. Typically, hospice patients are pets who have a life expectancy of 6 months or less, or if life-prolonging treatments are no longer effective or desired.
You define that very well. I'm much
Well, thank you.
clearer now. Thank you. So you mentioned a few things, as you were discussing the difference between palliative care and hospice. Can you delve a little bit more deeply into the specific ways that a rehabber might help a pet to maintain their independence and mobility, to improve engagement with their family, et cetera, et cetera?
Rehabilitation can address physical, functional, and even emotional aspects of the pet's life and contributing to this enhanced well-being. And I think one of the biggest roles we play in rehabilitation is in pain management. There are things that we can do as rehabilitation practitioners, such as therapeutic exercises, massage, or joint mobilizations to aid in pain relief. And we can also use modalities like laser therapy. And one of my favorite is the Medcovet Luma, who is our sponsor. And there's a reason why they're our sponsors. We really believe in the product. And this is where the Medcovet really shines. No pun intended here about light therapy, but this is really where it shines because it's really effective for controlling pain and inflammation, but it can be done in the comfort of the pet's home by the owner. So we don't have to travel to the clinic 3 times a week for laser therapy. It can be done at home and monitored via the app by the clinician. So it's one of my favorite modalities for using in hospice care and palliative care.
This patient population would be ideal for
Absolutely.
using this modality at home.
Absolutely. It's one of my favorites. And we also play a crucial role in maintaining mobility and function. So our aging pets or our ill pets can certainly face mobility challenges. Rehabilitation exercises may include passive range of motion exercises, muscle strengthening exercises, and anything that we can do as rehabilitations to make the pet's mobility better or easier for them to get around or sit or stand, and mostly to perform daily activities. So there are things that we can do to assist them in their daily lives. Dogs with chronic illnesses or dogs that are in the final stages of their lives, they can also be prone to secondary complications. So dogs that are down are probably going to experience things like muscle atrophy, joint stiffness. These pets are also more likely to be prone to a secondary, injury from slipping or falling on hardwood floors. And we have solutions for that. That's what we can come in. That's where we shine. We can come in and make recommendations for home modifications. We can incorporate our Dr. Busby's toe grips, and we could talk about things like proper bedding so dogs don't get bed sores, and how to protect the integrity of the skin. And we can also talk about assistive devices, braces, slings, and mobility carts. And these are all adaptations that can significantly improve a pet's ability to move around and participate in their daily activities, right? And Chris, my favorite thing is it all plays a big part in the emotional well-being of the patient.
Ding, 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 ding.
Right? It has a positive effect on the pet's emotional well-being. Engaging in gentle exercises and activities can provide mental stimulation and contribute to the pet's overall happiness and contentment. We're the full package. What's the full package?
Miracle workers, I say.
It's a full package.
I wanted to back up and just comment on a couple of things. When we started doing this podcast, we had so much information that we wanted to get out there to folks. And the earlier shows focus on a lot of the things that you mentioned, because that is, I think, kind of the core of what we do as rehabilitationists. So, we talked about the importance of traction. We talked about techniques, massage and range of motion. And, we have a accompanying YouTube channel that demonstrates a lot of these things as well. Going back to the basics and just how much the power of touch and interaction and that time with the owner doing these things can provide so much value to the pet.
Right. And it's special one-on-one time with mom or dad, right? How great is that?
And I know you mentioned the Medcovet Luma. Did you mention Shockwave as well? Is this something that you would consider using, or ultrasound, anything like that, e-stim?
Yeah, good question. I did not mention Shockwave. And for me, I know it's been around for a long time, but for me, this is sort of a newer modality. And I haven't had a lot of experience with it. But with some patients who have had Shockwave therapy, I have seen benefit, particularly for some of those patients that have like tendinopathies. I tend to steer away from ultrasound because I think that, it was something that we used a lot when we first started as rehabilitation therapists, but I feel like we've moved away from it a little bit. And ultrasound is tricky because you got to shave the fur, and some clients
Get all
don't always
gelled up.
you get all gelled up, and sometimes clients don't like that. And yeah, neuromuscular electrical stimulation can certainly be used in conjunction with strengthening exercises. But again, it's a little bit complicated in that you have to shave them, and it's not always comfortable to get that, use the e-stim. But I've used it in combination with strengthening exercises to get those muscles to contract, especially with patients who are tetraparetic or paraparetic.
Yeah, it was revealing to me, Kathy, when you were talking about, palliative care is really what we do every day. And so I've really reframed how I think about it. And so, we do have all of these modalities at our disposal, and that's great. So again, it may be just somebody getting over a more short-term illness and recovering from a medical condition or a physical trauma that some of these other things might be helpful for, versus
Right.
your end of life patient,
Yeah.
where the modality, like as you said, might be more complicated, and the cost to the patient may be more than the actual benefit could provide, especially
Right.
if their time in this plane is short. You mentioned rehabilitation exercises too, and I always get pushed back, especially from the people side of things, that, oh, PT, physical therapy, that's pain and torture, and you're a physical terrorist, and it's all pain and no gain. And definitely in the veterinary world, well, even in the people world, that's simply not true. One of the first and foremost things that we need to do in order to exercise effectively is control pain, as you mentioned.
Right.
But then, how do you start with exercise? What does a simple exercise look like? Can you describe some of those?
I've often heard people who sought me out, with their senior dogs or their dogs who are at end stage, that their veterinarian has told them that their dog is simply just too old for rehabilitation. And I would argue that a lot of those patients are probably some of the best candidates for rehabilitation, because I'm not going to put you on a treadmill and run you for a half an hour. Rehabilitation specialists can create personalized care plans based on the specific needs and limitations of the pet. So this individualized approach ensures that rehabilitation efforts are tailored to the unique circumstance of each animal. While canine rehabilitation can't cure a terminal illness or stop the aging process, but it can contribute to making the remaining time more comfortable and enjoyable for the pet, right? So what does that look like? What might that look like? For a lot of my hospice patients, I do things like light massage, compression massage, skin rolling, anything that I can do touch-wise that can relieve tight muscles or relieve muscle spasm. And those can be very gentle. It doesn't have to be, it's not a sports massage. I'm not digging in there with my elbow. I'm doing some very gentle things that can help to relieve these tight muscles and this, muscle spasming. And I have this cat who I see who's 21 years old, and he can't really stretch very much on his own, or not the way he really needs to. And he just needs some assistance in that area. And he loves it. He loves for me to stretch his back and his shoulders and his hips. And he feels so much better after that. He's really, I don't know what the word I'm looking for. He's really appreciative, I think, of that, right? I think that he enjoys that and it helps him. And some of the other modalities I can use is things like moist heat to relieve stiff joints, or ice to help control inflammation. We talked a little bit earlier about passive range of motion exercises, and that can be done at home by the client or by the rehabilitation practitioner. And that helps to improve joint motion and facilitate the health of cartilage and increase circulation and diminish swelling and help with pain. And it's done very gently, very rhythmic, very methodical. I'm not bicycling your dog. I'm not going as fast as I can. I'm moving those joints to their range of motion, and that's going to help the dog with some discomfort as well. And then as the other thing that we can do is hydrotherapy. If your pet enjoys swimming, it's a no impact exercise, right? If your dog is healthy enough or well enough to swim and they enjoy swimming, it's a good strengthening exercise, and it's good for the circulation. And walking on the underwater treadmill, it provides so much buoyancy. We are reducing the impact on the joints while allowing for controlled movement. And we can significantly unweight those patients so that they're comfortable when they're walking. It's probably safer than walking on land, you know?
Yeah, there's certainly less likelihood of falling, and everything is slowed down in that treadmill.
Right.
It's warm water. There are just so many benefits and ways that we can accommodate a patient like this.
Right.
You know, I asked you, like, what do some of these exercises look like? And I remember a while ago, we had this discussion that you mentioned simply standing can be an exercise. So if this is a pet that's, quote, down, so getting them up, even if they're supported with an inflatable peanut, for example, or a sling or in a cart, that's exercise. If you, our listeners, have ever had an illness or a significant operation where, you know, you're hospitalized, it takes a lot out of you. And, you know, simply going to the bathroom, you know, getting up to get a drink is challenging. And these can be some of the things that we're working on with this type of patient. I also think of like bed mobility. So, you know, again, working with people, it was, you know, how do you get into and out of bed safely? Can you transfer from the bed to a chair? For our pets, it can be rolling from side to side. It can be, you know, sitting up from lying down. It can be standing, you know, getting up from the ground. You know, but how do they maneuver? Can they get to their water bowl and food bowl and things like that?
Yeah, like getting to the litter box. Like for cat owners, that is so important that their cat has enough mobility to be able to go to the litter box either with minimal assistance or on their own. You know, it's huge. If you can get to the potty by yourself, if you could stand to eat, those are all exercises.
Yeah. And just reframing that word exercise to a functional activity. They're synonymous.
Right.
The functional activity, the need to perform a function and move to do that function is a functional activity. And that is also an exercise.
Right.
So
I think we should use functional activity because exercise gives me the, but functional activity is like, yay.
Right. So
Okay.
Kathy, I'm going to pivot a little bit here.
Mm-hmm.
Can you tell me about collaboration that you have as a rehabber working with a hospice patient or in palliative care, and the communication with the veterinary team and the pet owner in this process?
So important. Canine rehabilitation professionals work closely with veterinarians to gather comprehensive information about the pet's medical history, current health status, or any ongoing treatments or medications. We also collaborate with veterinarians and pet owners to establish realistic and achievable goals for the pet. So like we talked about, maybe the cat who's 21, their goal is, we just want them to be able to get to the litter box. Is this a realistic goal? Is it an achievable goal? So these goals might focus on pain management, improving mobility, maintaining muscle mass, and just overall enhancing overall quality of life. Collaboration with the vet includes, for us, sharing assessment findings, right? Discussing treatment options and ensuring alignment in the overall care plan. So everybody's on the same page. And I think the regular updates between the rehabilitation practitioner and the doctor just help us to refine the approach to the pet's needs as they evolve.
Yeah, and I was going to say, you know, these needs can change and evolve very, very quickly.
Right.
And, you know, talking about you interacting with the pet owners, I think it's very, very important that we listen and not project our views on what like the goal should be. I think sometimes we fall into patterns and fail to actually listen, but rather, you know, anticipate or have a preconceived notion about what that pet should do. And maybe that's not important to the pet owner nor the pet, you know, so listening skills and proper communication are utmost important.
We have to meet the animals too, where they find their joy and not where you expect their joy is. Meet them where they find the joy, meet them where they're at. Maybe not your own expectation of what you think that pet should be doing.
Right. And that's a good point too, Kathy, because we need to listen to the pet. We've talked about that ad nauseum in the past too, you know, so listening and learning what their joy de vivre is, in addition to the pet owners.
Yeah. The other thing that keeping in mind with collaboration is that some cases that are palliative, some patients who are in palliative care end up transitioning to end of life care. And this is where it's really important for the rehabilitation professional to collaborate with the veterinarian and the pet owner to ensure this sort of seamless transition. Again, everybody's on the same page, and this may involve adjustment to the care plan to focus on comfort measures and maintaining that pet's dignity versus getting the pet better, but transitioning into end-of-life care.
Are there specific challenges or considerations in implementing canine rehabilitation in hospice and palliative care, specifically in regard to maybe the setting and how these can be addressed to optimize the overall care provided to the pets?
I think the thing that is challenging in a hospice situation or just in general as a rehabilitation practitioner is identifying pain levels in pets. We do have some really good pain scales out there, and those are very helpful. But I might come in and assess your animal at like a pain level 4, and the owner says it's a 7. And unfortunately, because pets can't talk, their pain level is sort of what we.
It's subjective.
It's subjective. Exactly. Yeah. It's subjective. And so I think that can be challenging. And then, of course, every pet has a different personality, and some are maybe a little bit more stoic than others. You might find some of your northern breeds like huskies, they like to talk, they like to howl, they like to bark. Is that a symptom of their pain? Maybe, yes, maybe. And then we have our labs who are essentially, their bodies are just like for utility. They're just like Jeeps. They just go. They go over all terrain and they don't really stop and think. So
that's a great analogy. Never heard that before.
But, again, it's just a personality thing. Dogs are different. Cats are different. Each cat is individual. Each dog is individual. So I think that can be challenging, assessing pain levels in animals, I think particularly cats, but in all patients. Again, the other challenge is that the health status of patients in hospice can change very rapidly and require, frequent adjustments to your plan. And hospice and palliative care patients, the hospital setting may not be conducive to traditional rehabilitation environment. And pets may be more sensitive to their surroundings. Maybe they are not traveling well. Maybe they have anxiety. Maybe they don't like going to the doctors. And so we need to think about that for the pet. Is it conducive for the pet to come to the practice, or would it be better to have the patient be seen in their home? So we need to think about all of the senses in these patients, especially their end-of-life patients. What do they see? What do they hear? What do they smell? What do they touch? What do they taste? And what are they feeling? So the hospital setting may not be the best for some of these patients. And I think that can be challenging as well. We need to determine where's the best place and the most comfortable place for these pets to be seen.
Right. And when I think of hospice again in people, I'm sorry, I keep bringing it back to, people experience, but, I often think of, you bring the patient home, your loved one, your relative home, maybe after being hospitalized, because now they're in hospice. And so like you were implying, Kathy, maybe there's a switch in the care plan that they no longer, go to the clinic or the hospital to receive services. But if it's possible, to switch that to a home environment. But also in people, there are facilities that specialize in hospice. So if they can't come to a home, maybe they live alone. That wouldn't be the case with a pet, but, so they need to go somewhere to be cared for and finish, their life with dignity. But there are similar facilities and settings where some of our pets can go, especially those that are maybe unhomed, and we're hoping to talk to some of those people on our show in the future that provide those types of services for elderly and pets that qualify as having terminal illnesses, and where they can actually go to receive these services. Right. As far as, the collaboration goes, again, with people, I often think of hospice, especially, as providing medications to keep the patient comfortable. Mm-hmm. And, a lot of times they can seem almost comatose, they're asleep as their body is shutting down and so forth. We really haven't talked about that end of it from a rehabilitation perspective, but how is our role different as a rehabilitation professional, and how do we work with with the pet owners and the veterinary community
Right.
to maybe even ask for those sorts of things. Like when we notice that they're not doing as well. I mean, I
Right.
realize that medication is only one component of the management, but I think it's worth mentioning.
So much more, can be
Yeah.
done. I think you have to think of hospice patients. So these are hospice patients, ends of life patients. That there's a community of people who believe in euthanasia, and then there are a community of people who would prefer their pets to have a natural death. And that doesn't mean that we should judge those people or abandon them. Those are people we really need to surround more so that we can support their pet in transitioning in a comfortable manner. So if you have a patient that the owner wants them to have a more natural death versus euthanasia, you need to come into the home as a rehabilitation practitioner and come up with plans for, okay, if this patient can't get up because he's medicated, then they need to be turned every 2 to 4 hours so that they don't get skin breakdown or pressure sores. We also need to make sure that we keep that the patient doesn't get urine scalding and doesn't have feces on them. They need to be able to stay clean. So we need to come up with a plan for being able to either get them outside or to express their bladder and then clean their skin afterwards. So we want to maintain the integrity of the skin. I think it's also important that, patients that are down and recumbent, those patients are at higher risk for things like atelectasis. So it's important for us to, as rehabilitation practitioners, to come in and move these dogs, right? Get them up sternal, move their joints. Maybe they can't stand. Maybe they could stand with assistance, or maybe they could stand with a mobility aid within the wheelchair. So they need to be up, at some point. They need to be
Kathy,
sternal and or up.
What is atelectasis?
Oh, lung collapsing. So we
right. I
need
know,
to-
like people, it's very common to get pneumonia from inertia and not moving.
Exactly. And some of these patients may get that. And that's where we might come in with some, capage if they're having some, congestion in their lungs. So there's a lot of things that can be done. And again, those are mostly for patients who are owners have chosen a more the natural death versus the euthanasia.
So what I'm hearing is that, again, there are so many other things that can be done versus just providing medications to keep them comfortable. And that may be true in the people world too. I don't know. This isn't my area of expertise, but I really want folks to hear that it's not giving up, that you can be proactive.
Right.
And, I guess that's one of the points of doing this show is to educate you listeners out there, through our podcast. We have other podcasts and shows that touch on the topic. Kathy and I, both work with vets, and then providing that one-on-one care. There's just so many ways to get the word out there about this, I think, growing field of palliative and hospice.
I just had a patient recently who started off in palliative care. This was the animal was a senior patient, and veterinary visits were very stressful for her. She was transitioning from palliative care to end of life hospice care. And, it was in her best interest, honestly, for me to do home visits versus her going into the hospital, because every time we treated her with rehab and then she went to the hospital for some, blood work or something, it would take days for her to recover. And I became very involved with the family. They were so nice and they loved this pet so, so much. And what I did was come in and I made recommendations for home modifications for this pet to make sure that the pet had good traction. And I made modifications in their therapy plan. And I was able to do laser therapy with her. And when it came to time for her to get things like she needed a nasal swab because she had some, discharge in her nose. I was like, well, I'll do that. I'll go over there, do her rehab and do her nasal swab, and then she doesn't have to go to the vet. So I think for her, and then she did end up being euthanized. And I think for her end of life was very dignified. I think her parents, what I wanted them to have the most of is control over the end of their pet's life, as much control as they possibly could, so that they didn't end up in a catastrophic event. Does that make sense? I want them to have as much control as they could. And then ultimately they did end up euthanizing her. But for her, I think that was the best way to go, was to have hospice and palliative care, or hospice come in, assess the situation, and then I would rally the doctors. I would involve her integrative holistic veterinarian and her primary care. And we were constantly in a loop of communication about her and how she was doing and what we could do to make her life better as it came to an end. And I think that we did a really good job with that. And although it was sad to see her go, I think that her overall, her quality of life up until she went was okay.
Successful end of life,
Yeah.
for lack of a better word, but we always
Yeah.
talk about success stories. And when we're covering this topic, I
Mhm.
think that definitely qualifies.
She had a good death experience. And that was the only thing I could offer her at the end, was to make sure that she got a dignified, graceful death. That she was a
Yeah.
loving pet for many, many years. And she gave that family, a lot of love. And they gave her a lot of love too.
I think we often talk about, ensuring that it doesn't come down to an emergency,
Right.
because that never looks and turns out as good as we would like. And I've recently had an experience with this, not with a client of mine, but somebody I know in the community, and her dog was failing. She knew it. This person is a nurse herself, on the people side. And unfortunately, one of her children had traveled for vacation. And as the pet was declining, they're like, please, try to keep her around so we can come back and say goodbye. The day before they got back, she ended up taking her emergently to be euthanized, and they didn't get to say goodbye. And, that was just really unfortunate. So, with having a team surrounding you and, different types of resources and things, which we'll get into here in a little bit. I just think there's a lot that can be done in terms of planning and being proactive and
Right.
so forth that we can take. We've touched on this a little bit, Kathy, but can you expound on the psychosocial aspects of hospice and palliative care?
I can, yeah. The psychosocial aspects of hospice and palliative care in pets involves addressing the emotional, social, and psychological well-being of not only your patient, but the client as well. So the rehabilitation process involves interaction between the pet and the caregiver. This bonding experience with us as well, not just with their pet, but the bonding experience can be emotionally comforting for both the pet and the caregiver, fostering this sort of sense of, companionship and support. And I can't tell you how many animals and families that I personally have fallen in love with, because this is a very intimate thing, to come into their home and take care of their dying pet. It's a very intimate situation or setting.
Yeah. And even if you're not in their home, because we both practice, this type of care in facilities in the past, I just think by the sheer frequency by which we see them,
Right.
we're kind of the boots on the ground, and
Yeah.
they may see, the vet, every few weeks or every few months as, things are getting more dire. But for us, it's often much more frequently than that,
Right.
even up to, daily to 3 times a week, depending.
Yeah.
So
It really is an intimate experience, honestly. And we get to know these animals so well. We can predict. I have animals that I know so well that I can predict whether they're going to fall to the left or to the right when they're standing up, just because I simply know them so well. And my hands are all over them. And it's just is a really intimate setting. And I love that. That's what I like about it. And these pet owners experience a range of emotions, right? Including grief and sadness and anxiety as they navigate these challenges of caring for a terminally ill pet. And so hospice and palliative care teams provide support and can offer emotional support and understanding, right? And the focus of hospice and palliative care is not only on the pet's physical well-being, but also creating opportunities for meaningful interactions, right? Between, or quality of time between owners and their pets. So we can contribute to the overall well-being of both parties. And pet owners benefit from being educated about care needs of their terminally ill pets. So empowering owners with knowledge about their pet's condition and treatment options and end-of-life care, it can help them make informed decisions. And I think when you're informed, you have less anxiety because you have all the information.
can you talk a little bit about anticipatory grief
Oof.
and bereavement?
Yeah, it's a big part of what we do in hospice is talking to owners about grief. And we talked about this on other shows about anticipatory grief. So these clients are experiencing, or they know their pet is going to pass, and so they're experiencing grief, or disenfranchised grief where, the pet has died and it just, other people don't understand, what you're so upset about. It was just a dog or just a cat, right? I think this is really where hospice and palliative care can help the owner So the veterinary team, along with the rehab team, can play a crucial role in providing emotional support, education, and resources to help pet owners navigate this grief process, because it is complex and it can come in waves. You might think you're fine today, and tomorrow you're in the supermarket buying tuna fish and you just break down, right? And start crying there. And those are all normal things as part of the grief process. And so I think establishing this open and honest communication with the pet owners about their pet's prognosis, the treatment option, and the inevitable progression of the pet's condition. And so I want to nurture a relationship between myself and the client to encourage these pet owners to share their feelings and their concerns. And so providing detailed information about their pet's diagnosis and treatment options and potential outcomes, I think that helps owners make informed decisions and sort of understand the progression of their pet's illness.
Right. That shared decision making is so vital. And like you said, empowering them and gaining some control over the situation. And but then, listening to you talk too, I worry about compassion fatigue. And that's a whole another can of worms that happens both to us rehabbers, veterinarians, as well as the pet owner, the pet parent, because there is a tremendous emotional toll when we're so feeling and compassionate about what we do, and that creates this fatigue that ultimately can be very dire as well. I think it's worth bearing that veterinarians have one of the highest rates of suicide, and there's many reasons for that, but this is certainly one of them, is compassion fatigue.
We talked to Erica Sinner about this recently. We interviewed her about her book, Pets Are Family, about, letting people know that don't be embarrassed about your grief. Don't be embarrassed about your emotions. This is all normal. And don't be afraid to ask for help. And we've done a couple of shows. We did Erica Sinner, Pets Are Family, and she talks about navigating her grief with the loss of her dog. We did with Lori Levine. We did a whole show on believing and grieving. She's a licensed mental health care worker, and she talks a lot about grief, disenfranchised grief, anticipatory grief. So if anybody's interested, they should go back and listen to that show. And there are a lot of good resources out there. We talked about Lap of Love, you and I, the other day. They have great resources on their website for clients whose animals are at the end stage of their life.
Lap of Love, as I understand it, is a veterinary company that provides care within the home and really serves that need for pet owners to have that resource, whether it's, hospice, palliative care, or euthanasia at home. I think there's a big movement toward keeping your pets comfortable within their home for, those final stages. And so having that option for at-home euthanasia is definitely a service provided by Lap of Love. So they're nationwide. Look them up, and we will have this information in our show notes as well. What are some opportunities for memorialization and legacy building? How are those integrated into hospice and palliative care process to help pet owners create lasting memories and find meaning in the pet's final days?
Well, I memorialized two of my dogs by writing books about them.
There you go.
So you can do that. Memorializing your pet is really an important part of the healing process. And I think it's something that creates an opportunity for pet owners to have these lasting memories and find meaning in the farewell process. So I think that memorializing is important. So we can do things like we can encourage pet owners to capture special moments with their pets. And we actually talked about on one of our shows about end-of-life pet photography. And so there's a organization called the Tilly Project where photographers will donate their services to come to your home and take pictures of your pet.
Love that idea.
Yeah, I love it. I love that. And I think that
not just come to your home, they'll meet you somewhere.
Oh, they'll meet you places. Yeah. I think
so. Again, part of this whole planning process, having that special photo, for example,
right.
I think you really, really will appreciate it down the road.
And there are other ways we can memorialize your pet. You can certainly do, nose prints or paw prints so that they're tangible, keepsakes. Planting a tree, writing a letter to your dog or cat or bunny, is a great way to help with the grieving process. Fill that book with pictures and memories and write down, remember that time, we went to the park and we did this and you found a stick, and just to relive those moments, because those are powerful to engage those memories, right? Like nothing is more powerful than that sort of reliving a great memory with them.
And not only reliving, but I'm thinking, creating more memories. How many people have we now seen on Facebook, Instagram, TikTok that are creating bucket lists for themselves and their pet and going on these fantastic travels, trips.
Right.
I just recently saw one about this dog
Right.
that's on the back of the motorcycle of this guy going all around the country. And the guy and or the dog has a GoPro on its head so you can see what they're seeing. And more simple things like returning to favorite places,
Right.
The beach, the farm, seeing favorite people, enjoying, maybe some special foods. Not that we want them to get an upset tummy,
Right.
in the final stages. But again, start doing that, in their senior years.
Mhm.
And I think that just goes so far into, again, creating memories and not having regrets,
Right.
even though
Right.
we never should have regrets because we're doing the best we can.
I encourage pet owners to embark on a legacy project that honors their pet's memory. And I think it's a great way to help with the healing process.
Yes. You don't have to travel this journey alone,
Yeah.
that you have every right to, but, surrounding yourself and your pet with people who care, that also are grieving, either by the potential loss or the loss that's happened. It's important for everyone.
Yeah.
And so, there are resources. Reach out to your friends and family. The whole attitude towards our pets, and as Erica Center said, pets are family, is changing. And as you said before, don't be embarrassed. I guess one of the things that I was thinking of during this whole podcast is I have had several clients, especially like day one, and I'm interviewing them, and I'm trying to establish the goals that we talked about and come up with a treatment plan and so forth. And they say, I say, so what do you want from physical rehabilitation? I want my dog to live forever.
Me
and
too.
I always get a in
Yeah.
my tummy when I hear that,
Yeah.
because that's not the reality.
Yeah.
And they know it's not the reality, but it
Yeah.
puts a lot of pressure on the team and yourself as a pet owner. Of
Yeah.
course, we all want our loved ones to live forever.
Yeah.
They give us so much, but knowing that they can't,
Right.
what can we do in the meantime together to
yeah.
provide that quality of life and that positive and dignified farewell experience?
I think that we should also not look at the death of our pets as a failure in some way on our part. It will happen. And to the best of our ability, we're going to make sure that that's a good experience for your pet. We shouldn't think of it as failure.
Well, Kathy, this has been a great discussion. I hope it gives our audience some fodder, to think about. And I certainly learned much more than I knew prior to us talking here. And I just, like we do with all our guests, want to ask you, do you have any, final thoughts that you want to leave our listeners with today?
I have so many thoughts, Chris, and I'm there. My head is swimming with them, but I think I'd like to say or end with, creating a positive and dignified farewell experience plays a crucial role in the psychosocial well-being of the pet owners during the hospice and palliative care stages. I think this goes beyond the medical components and addresses the emotional, social, and psychosocial needs of owners and their pets. And a positive farewell experience allows pet owners to emotionally say goodbye to their beloved companions, and providing a supportive and compassionate environment during this process helps to ease that emotional burden and contributes to a sense of closure. So I think if you have a patient or if you have a pet that is in the end stages of their life, I think it's very reasonable for you to reach out to hospice and palliative care veterinarians and veterinary technicians, because we can support you in that journey, in that part of the closure of your end of your pet's life.
And again, if you don't have someone that specializes in this field in your area, there are online resources, and you could always start with your pet's primary veterinarian, because they will be a great resource as well. So as always, Kathy, I will put the various resources in our show notes for people to check out. Once again, the International Association for Animal Hospice and Palliative Care, Lap of Love, a grief hotline, and perhaps some of our links to various shows that touch on this topic with Lori Levine, Erica Center, and Becky Schoenberg, to name a few.
Well, thank you, Chris.
Thank you, and we'll catch you later.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at Petability Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you, and tune in next time.